because if you are ready to take primary complex antibiotics for 6 months, you should bear with us for 6 months with Ayurveda medicine. Then only it will be cured. Okay. For that, first 3 months there should be Hedu Virdam Vyadhi Virdam drugs. Next 3 months should be Rasayana drugs. For first Hedu Virdam Vyadhi Virdam, if it is Pratishaya Swasakara Pradana, better drug is Kamavadaharan Dashamulagadutray. If it is Dwara Pradana, Indugandam. If it is Chaya Pradana, Ela Ganadi, which is mentioned in Rajakshma Chilsa. Vyadhi Virdam, I always mix a quada with Arista and a syrup. Why? Because finally that cocktail will be so sweet so that the child will take it very easily. So a Vyadhi Virda Arista has to be mixed with a Hedu Virda Quada. For example, in RRTA Pradishaya Swasakatu Pradana, Dasamulagatutrayam, Amrita Arishtam, plus 1 bottle of septilin syrup. That will be a big, good cocktail, of which the syrup septilin is published in PubMed. So I am not hesitant to say that I am using that patent medicine. Okay, if you are mixing these three, that will be a beautiful cocktail and that will be taken very easily by the child. If it is Jarapradana, Indugandam, Amrdarishtam, Septilin. If it is Elaganad, if it is Chayapradana, Elaganadi, Karagasavan, Septilin. Similarly, 6 months of time has to be, 3 months of time has to be spared with this group of medicine. After that, if it is Chayapradana, try to do Chavanaprasham. If it is Pradishaya Pradana, better Agastya Rasayana. If it is Jara Pradana, Indugandha Garda. Mind it, Agastya Rasayana from the Cortical company is not different. If it is from Vaidyaratnam company, that would be very nice to eat. And otherwise, not a single child will take Agastya Rasayana from Cortical. Many other pharmacies, because it is so bitter in taste. So these people, Vaidyaratnam people are making good, palatable Agastya Rasayana. Otherwise, nowadays, there are several companies who are making Agastya Rasayana granules that can be taken. Anyway, there should be 1 Rasayana Chikitsa for next 3 months. Then the total RRTA will be vanished. So these are the 6 months of medication. Next is asthma. Dr. Radhika or any of the hosts, hello? Any of the host, please respond.
Yes, sir. Yes, sir.
Am I okay with this style of presentation of dealing each and every disease? Or yes, whether it is in need of more and more academic discussion or not?
No, sir. Perfect. This is going perfect.
Okay. Now, the asthma. Asthma is an older terminology. Better you use a reactive airway disease in children. After 2017, the better terminology is reactive airway disease. See, reactive airway. The airway, the tracheal bronchial tree is reacted to something. Which thing? Allergic thing. What is allergy? Anything can be allergy. Allergy can happen by anything, in any mode, in any way, in any symptom, and by any person. That is the peculiarity of allergy. Allergy can cause any signs and symptom except pregnancy. Nobody will be pregnant by allergy. Otherwise, all other signs and symptoms can be produced by allergic mechanism. So, reactive airway. Airway, the total tracheobronchial tree will become reactive. Reactive in the sense, 3 things will be kept in mind. Number 1, bronchospasm. Number 2, mucosal edema. Number 3, increased mucus secretion. Bronchospasm vadiga in nature, mucosal edema kabaja in nature, and increased mucus secretion kabaja in nature. And sometimes Paithika Swabhavas like hyperemia can happen. If it's so, that will be pitta dominant reactive airway. And how to make an endpoint in vicious cycle of eczema syndrome is a very headache usually while dealing with asthma, because most of the reactive airway diseases are associated with skin disease. Whenever you are treating the pitta dosha of skin disease by Chidavidya drugs, kapha will increase, that will produce asthma. Whenever you are reducing the asthma by using Ushnavirya drugs, the pitta will increase, that will reduce asthma, it will increase skin disease. We call it as eczema asthma syndrome or otherwise atopy. These are the 2 major concerns in several practitioners. One thing is sure, if it is Paka, reactive airway disease, it will not be cured without Shodhana Chikitsa. It will not be cured without Shodhana Chikitsa. So, for children after 5 years, Mrudu Virajanam. For children after 10 years, 3 Vamana at least per year is needed. Vamana means simple Vamanas. Sadhya Vamanas are very simple. It's an OPD procedure. Tell the child to come in the morning 8 o'clock. They can go by 9 o'clock by happily singing and dancing. The thing is that Vamana after 10 years is very, very, very easy procedure. Don't get afraid of Vamana. Shamanam, as I told you, if the hyperemia or skin disease or any other pitta symptoms are associated with asthma, no doubt Kapha Pitta Hara treatment has to be given. If the pitta symptoms are not associated, pitta symptoms means pittam tojistidam kudyad vispotagama suriga. Tekte pisapam daham, mamse mamspaga godanam. Sadahan medasi grandin swed atyudgamanam trusham. Siragatam krodanada pralabam. Don't neglect the krodam of the child. Asthini daham prasam, majji haritra naganetrada. All these are the different types of pitta symptoms that can be associated with any of the kapha symptoms. So mind it, as it is, asthma is a resapradosha vigara maximum. Resapradosha pitta vigara or recta pradosha pitta vigara can be seen, not the shukragada rogas. Of course, Kapha Pitta Hara is in need of there are certain treatment conflicts for Kapha Pitta. Kapha is in need of Ushna, Pitta is in need of Shita. So Kapha Pitta is in need of, actually Shita is in need because it should be Shita, Tikta and Pajana. So the Pajanas are inevitable in Kapha Pitta Hara. So my point is that divide the asthma with the presence of Pitta, without the presence of Pitta. If it is with the presence of Pitta, certainly there should be Vamana and Virajana. If it is without the presence of Pitta, you can have only the Vamana and you can have, if it is needed, Murdu Samshodhana can be done. This is the point to be taken into consideration. In Virajana, what I am using, Draksha Truvruta Kwada, otherwise Truvruta Lehya or Hridya Virajana or Kalyanangula, all are Kapha Pitta Hara type of medicines which gives Murdu Virajana in children. In case of Sadhya Vamana, I usually use Yashti Vidanka Pipali Kwadam, otherwise simply the Matanafala Kwadam or simply the Levanambu is more than sufficient. 3 glasses of Levanambu is more than sufficient. By using a toothbrush, you can make the child with good vomiting and vamana, and it is so easy procedure. If it is Pakka Kapavadigam, the classical examples are Balaji Regadika Kwadam, Ayovayan Kwadam, Vesuvulagatrayan Kwadam. All these are the different examples of Kapavata Hara treatment. But if you need Kapha Pitta Hara treatment, what are the Tikta Rasapradhan Dravyas that can be used? That is very important. Panchatiktakam, for example, if you are purchasing the Panchatiktakam from the market, you will be totally unsatisfied practitioner because Panchatikta doesn't hold all the ingredients in the right way, in right form. So you prepare your Panchatiktaga by adding Niditiga in larger quantities. That will give wonderful results in eczema asthma syndrome. Along with that, you can use Kanagasavam, Shwasanandam, Pushkaramulasavam. These are the different Vyadhi Viparita Aushadas. In primary complex, Bala TB in Malayalam, primary complex. See, if it is a primary complex, why if it is a primary complex? Majority of the primary complex diagnosed by the allopathic doctors are not primary complex. This is not told by only by Dr. Dinesh cases. No, it is a widely discussion in Indian Journal of Pediatrics. Many of the pediatricians in India are misdiagnosing primary complex into several non-primary complex cases are getting diagnosed as primary complex. What are the roles of Ayurveda physician? You know, if it is a a Paka 24 karat primary complex, I won't recommend Ayurveda management. I will recommend only the allopathic medicines. But majority of the cases are not primary complex. Advice. Diagnosis of primary complex is very easy, but nobody is going into that details. Everybody is looking into Mando test. Mando test may be false positive. Mando test is not a reliable test for TB nowadays in India, Bhutan, Afghanistan, Pakistan, like countries, because everybody is taking BCG. So there are chances of getting false positive. Look into the blood picture, look into the chest X-ray, that are the golden standards. And mind it, if at all it is the primary complex, after having 6 months of medication from allopathic side, damn sure that the child will not get rid of recurrent upper respiratory tract infection. In such cases, we are supposed to manage the post-AKT management with Ayurveda, similar to the concept of recurrent upper respiratory tract infection in children. Primary complex has to be diagnosed by, first one should be clinical feature. Without a clinical feature, nobody can present primary complex. So there should be fever, night fever, there should be rhinitis, there should be recurrent upper respiratory tract infection, there should be regional lymphadenopathy. Certainly there should be loss of appetite. Without loss of appetite, nobody can present these primary complex. Raised TC beyond 14,000, deranged DC, raised ESR beyond 40, X-ray should clearly shows increased bronchovascular markings and opposites, and Mando test can be done if it is needed. Along with the AKT, if the anti-cox treatments are going on, if allopathic treatments are going on, still you have to manage the dysbiosis coming out of the 6 months of anti-cox treatments. And this is a Malayalam yoga. You can have, the host can have a screenshot of it and you just translate it and put it into the group of the contestants. This is from Vaidya Manorama. This is, I am widely using during the anti-cox treatment. If the child is protected, if the child is need to be protected from the liver damage, if the child is having severe loss of appetite, Velamulavadum Vigam, Willam Mugavum, Chukujiragam Malarum Mavila Netum, Washa Mula Garimbu. This quata is very powerful, and post-AKT treatment is similar to the respiratory tract infection. Now, gastrointestinal system. In gastrointestinal system, I am not at all treating acute gastritis, acute diarrhea, and acute vomiting, because children are highly volatile and they are highly prone to develop this sodium electrolyte imbalance, because children and cancer patients after chemotherapy, both these are highly liable to produce electrolytic shock, because RECAM is a program in our college by me, that is the cancer management through Ayurveda, supportive management. Many patients are getting acute diarrhea and vomiting as a part of their chemo complication. That is usually happening by simply, if you are managing the sodium potassium, you can prevent the death. That is usually an outcome after sodium potassium problems. If it is chronic recurrent vomiting, regularly if the child is vomiting out daily while brushing, daily after foods, for a long time, for the past 6 months or 3 months or 2 months, following DD, very important, chronic gastroenteritis, gastroesophageal reflux, There are certain systemic infections in which there may not be any frank fever, but rather there will be chronic vomiting, overfeeding in young children, otitis media. See, most of the migraine in children are presented with cyclic vomiting, not the headache. Most of the hypothyroidism in children are presenting with the recurrent vomiting, not any edema or bradycardia or roughness of the skin. Most of the urinary tract infection without telling the dysuria, the child may present with vomiting, school phobia. These are the common reasons. I use broad spectrum. Amase ulklesha bavahi sakwa chardiyo mada lenghanam eva tasmal prakharayan marudjan vimuchya samshodhanam va kapapitta hari. The principle of management is according to the Charaga Chikitsa. By keeping that principle, I usually manages with Niobium abiaristum hinguajadi vidodilehim as a broad spectrum prescription. But by looking into the following DD, if it is mesenteric lymphadenopathy, it's a common case among the children. If you are a practitioner, you may be knowing that recurrent abdominal pain and recurrent vomiting whenever they are getting scanned by ultrasonography, it can be seen that non-specific mesenteric lymphadenopathy, that will be the report by the radiologist. It is non-specific to the radiologist only, but it is specific to the child because she or he is suffering from vomiting or abdominal pain. And in chronic UTI, all these cases should be managed according to the principle of Antarvidradi. So, Varanadi type of prescriptions are very useful. If it is otitis media, upper respiratory tract infection, Kapavadaharam, Desmoladotrium. If it is gastroesophageal reflux, many a time it is Vata Vigara. Vata is pulling this pitta from Amasya upwards. So, Vata has to be made anulomana instead of prescribing Sudashagara Rasa or Avipatikara Churna. That will give momentary relief, but for 100% result, you should give Rajanyadi or Pida Munmargagam Vata Manloma Yudikana, that is Rasonadi, Rasona Karavi Krishna Stirabi Saditan Jalam, Pida Munmargagam Vata Manloma Yudikana. So Vata Anulomana has to be given. If it is chronic recurrent vomiting, Prasakta Vamadu, even though it is contraindicated for Vasti, you will get a good result with the plain Neruha with Madhu Dailiga. If it is migraneous type, how can we diagnose migraneous? There will be positive family history to the parents. Parent means mother. Mother having migraine, if the child is having cyclic vomiting, majority of the cases that will be migraneous. So Amashikata Vata has to be treated by Kalasagadi, Indugandam for hypothyroidism. These are the usual prescriptions from my side. This is a Malayalam quotation for external application for recurrent vomiting. For external application over the chest and abdomen, please host, take the translation of it. Out of this Ruja is Kushtam, Jalam, Musta, Ushira, Ruja, Kushtam, Dhatri, Shida, that is Hriberam, Kiryat, that is Kiratatikta, Pachila, Ela, Gairi Gashali Samyuktam. All this has to be powdered and mixed in Jiraka Kwada, and it has to be mixed with rose water and Stanya, and it has to be applied all over the chest and abdomen so that chronic recurrent vomiting will come down. Chronic diarrhea. Putting full stop is a mirage many of the time if it is associated with the protein energy malnutrition. Mind it. Because 2 cases in Ayurveda OP. Number 1 is chronic diarrhea. Number 2, chronic skin disease. Both are prescribed with severe pathya by Ayurveda Vaidyas, turning into malnutrition. Finally, in malnutrition, the villus atrophy will set in. Finally, the child will suffer from chronic diarrhea due to malnutrition. Finally, a vicious cycle will be formed whether the malnutrition had set in first or whether the diarrhea set in first. This is a ambiguity, very difficult to treat in such condition. So, how much Pathya has to be incorporated is very important point. Skin and GIT combination I always treat with Antarvitradi or Antarvisarpa Chikilsa. And Antarvisarpa Chikilsa I usually do by putting the following major differential diagnosis: chronic gastroenteritis, celiac disease, cut all the casein and gluten, milk and milk products, wheat and wheat products. Autoimmune enteropathy is so common nowadays. Nobody knows how to diagnose it. There will be raised immunoglobulins in such cases. Autoimmune enteropathy, cow's milk allergy, chronic non-specific diarrhea. It means that modern people don't know how to diagnose that diarrhea. Most of the cases that will be our Paka Amadisaram. Cystic fibrosis is nowadays common. It is Kapavaitika type of Adisaram. Okay. These are the common cases in chronic diarrhea. And antibiotics, usual usage of antibiotics is a common cause of diarrhea, irritable bowel syndrome, lactose intolerance, HIV enteropathy. These are other common DDs in chronic diarrhea. All these can be managed successfully with the principle of Shiralasa. Devanam Pajanam, not a Stambanam, Vishaharam. Vishaharam has to be incorporated. Just a minute. So, Vishahara treatment is all the Dushi Vishas are Dhatu Pradarsa Vikaras. Common disease can be produced by Dushi Visha. Stidam Rasadi Swadava Vijitran Karodi Dhatu Prabhavan Vigaran. So, any disease, if it is chronic in nature, do Dushi Visha Chikilsa along with common treatment. Here also, Dushi Visha Chikilsa is very important. And chronic diarrhea should not be stopped by Stambara Dravyas like Kudaja. Jadi Phala Prasham in neonates, Ajamota Prasham in neonates, Villuadi Guliga. You know, Villuadi Guliga is a powerful drug which can be used both in AMA and Visha. Where AMA is in need of Ushna treatment, Visha is in need of Shita treatment. Visha is in need of Stambara Chikilsa, AMA is in need of Shodhana Chikilsa. So, AMA Visha is a Chikilsa Vairudyam where Villuadi Guliga can be very effectively used because Bujanga, Ludundru, Krustiga, Adir, all those toxins along with Visha, Gara, Jara, Ajirna, all this can be very well managed by Villuadi Guliga. Mustarishtam, Rajanyadi Churnam are the usual drugs. And certain mistakes from the common practitioners that all chronic diarrhea are ama janita. Don't give initial kashaya in that. It will probably increase the condition because kashaya inherently has some stambana properties. Dadimastakam can be effectively used as broad spectrum because it will give good Dibana along with the Grahi property. Kudajaristam and Mustaristam, don't try to give aristas in lactose intolerance or any other pitta vigaras because aristas are pitta increasing type. So don't give it in polyp case, don't give it in lactose intolerance, don't give it in ulcerative diseases. Rajanyadi Churna can be effectively used in all conditions. And my divine drug for every chronic diarrhea is Adhivisha Mustashundi. Mind it, Adhivisha is high costly drug. So add it in very less quantity. Not only that, I had certain complication with Adhivisha even though it is Nirvisha. I am not sharing those complications because of certain ethical issues. One thing is sure, there are chances to get complicated cases by using Adhivisha. Complication is cardiac arrest. There are probable chance to get a cardiac arrest by using Adhivisha, but it is highly powerful drug. According to poisoning is so alarming. So add in very minimal quantity. I usually use 10 gram of musta, 10 gram of shundi, 2 gram of Adhivisha combination powder, 2 gram of Adhivisha combination powder. And from that powder, 1 spoon, boil it in 1 glass of buttermilk. Reduce it half glass. That will be a powerful pravatya. For pravatya, prochede, dravya palal, kalki, krital, sardal. It is in Adhisara Chigilsa, Charaka Samhita Chigilsa. So Adhivisha Mustashundi is a powerful drug. It can be given in IBS, irritable bowel syndrome, ulcerative colitis, all other chronic diarrheal diseases. It's a powerful medicine. Only thing is that Adhivisha should be in a lesser quantity. Hinguvajati gulika, it is too Ushna Tishna because all of you know its ingredients are highly Ushna Tishna. Hingu, Vaja, Vijaya, Pachuganda, Dadima, Deepa, Kadanya, Kapada, Pushkara, Pulaha, Chadi, Habu Shakni. See, Satindranigam, Saveta Samlam, all these are Kattamla level drugs which cannot be used in Paithika Vigara in Costa, so don't prescribe it in lactose intolerance or any other diarrheal diseases which is having Rekta Pradasha Vigara. Villadi Gulika is powerful drug as I told you for the Dushi Visha Jigisa. Now let's go to constipation. Everybody is treating constipation by using laxative drugs. Don't do that because Virejanam is Lankana Chikitsa, Lankanam is Vadavardhanam. Actually, constipation is Vadarogam. Pakvashakata Vata is presenting as constipation. So constipation should not be treated with a Lankana Chikitsa, that is Virejanam. Better you do Snehasvedam in the Costa. How can we make a Snehasvedam in the Costa? Then I will say. Initially, even the parents are telling that it is a case of constipation. You should examine the sigmoid colon. Unless and until the nodded colon is not, then it is not the case of constipation. Varchakarmana Guruvandi, Yestabalatri Hadu Param, up to 3 days, child can hold the fecal matter without having any constipation features. So 3 days are okay for children. So examine to confirm its diagnosis, then advise the case, then treat the case. Rectal management is so common among traditional practitioners of Kerala, especially by putting certain soap, by putting certain patti, by putting certain metric of tamarind. These are the different usage of rectal application to get relief of constipation. This is highly unscientific. Don't promote that. The universal Snehasveda in the Costa is by using Jala, you give only lukewarm water. Try to give 10 glasses of water. Constipation will be relieved. Ensure food. If the food is not taken, how can they pass through? That is very important part. So ensure food. Then ensure fiber. At least 3 days. At least 3 days in a week should be with green leafy vegetables.
Sir, voice is fluctuating, sir.
Is it?
Now it is fine, I guess.
Is it? Is it okay?
Yes, sir.
So ensure 3 days of fiber at least in a week by giving green leafy vegetables or by any vegetable salads, not raw salads, but boiled salads. So ensure fluid, ensure food, ensure fiber, very important point. And after that, Snehasveda in Costa by using Sukumara Grida or Dhanvantara Grida or Abhaya Arishta. See, Grida can be mixed with an Arishta. Why? Because it will be acting as Sadhya Sneha. Because Sura Misradam Sneham is Sadhya Sneha, according to our Acharyas. It will give immediate Snigdha in Costa. So, Sura Misradam Sneham, that is Sukumara Gradam or Dhanvantara Gradam Abhayarishtam, plain ghee with hot water or Draksha Swarasam with ghee. Simply the Mysore Padam of our Kerala, Palangodan is more than sufficient to give good snigdhatva in the costa. Now, loss of appetite, that should be defined by the physician, not by the parent, because many of the parents are not satisfied by the food habits of their children, because they all need parents baby, even though they are 35 kilogram of body weight. Mother is 35 kilogram, father is 45 kilogram. Their child is in need of 3.8 kilogram by birth. How come? Anyway, so such a how much parent is eating very important. That much will be the eating capacity of the children. So everybody cannot be converted to Amitabh Bachchan. Everybody cannot be converted to any other glamorous person. So the thing is that child will be obviously a glamorous kid up to 2 years of age for everybody, and after 2 years they will be shifting their nature of their pickup by the food and other activities. Okay, so loss of appetite should be well defined by the physician, whether they are taking sufficient quantity of food. Probably they may not take rice or chapati. Probably they are having much more apple, fruits, dry fruits, bakery items, and stomach will be full. At that time, they will not take the roti, dal, chapati. So at that time, you are not supposed to diagnose it as a case of loss of appetite. If the child is playing actively, if the child is having fecal outputs, that child is taking food, no doubt. And usually, Sagrasa drugs are advised for the loss of appetite. Sagrasa drugs, best one is Triptirahara Gudanam Frashtam. You know, Triptikranam Frashtam, Shundi. So Shundi is the best drug for loss of appetite. It can be given Sagrasa, or it can be given in another form too. Ashtachurnam, Ingvashtaka Churnam. That is best medicine for Aruji. Otherwise, Gulardragam Lehyam. I prepare Gulardragam in another way. Take 10 ml of or 5 ml of Ardragosarasam, 5 ml of honey, put 1 pinch of Saindava in it, mix it, give it several times in a child above the age of 3 years. That will be good appetizer and good Dibra drugs. It reduces Tandra, it reduces Truti. Abhayarishtam, Vidangasam, Majabodarthagam, Mustarishtam is a common practice in Kerala to give much appetite, but I won't promote it because it is a Grahi Aushadam. Now, if you are going to the Krimi Chikitsa, now it is 9 o'clock. Okay. How much we can take, Radhika madam, the time?
Sir, namku edka, sir. No issues. You can continue, sir.
I
Till
can
10
finish
o'clock.
it.
Yes.
Even though probably the contestants or our delegates may be in Tantra, Nidra, Vada, Shobho, Belavyabadi Lakshanam, but I am not in. Even though my pitta is towards my ojas, Guruttam, Stabda, Dangeshu, Gladu, Varna, Vedanam. Everything is suffering from my side, but still I will attack with my slides. Krimi. Okay. See, the usual problem with the critical size is how to make an endpoint of the krimi. That is very difficult. And moreover, in our Samhitas, Apakarshana is the first management. Apakarshana is outdated in our Samhitas because all of a sudden, in a fine morning, before the krimis are rising up by the sunlight, we are supposed to give Pamana, Virajana, Tasya, Basti, everything all of a sudden in a given fine morning. That is quite against the rights of children. But in previous days, Acharya were supposed to do that. Why? Because of it was inevitability at that time before the invention of albendazole by present citrate compound or mebendazole. Trustee of Ayurveda is Prakriti Vigadam, not the Apakarshanam. The best medicine for Apakarshanam, I also prefer albendazole or mebendazole or Krivishodhini is not that much powerful when we compare with albendazole for apagarshana. But for prakriti vighadam means the circulating larvae and cysts which are creating the recurrence of the Krimi problems. That cannot be managed by this albendazole or mebendazole or any anthelmintics. The powerful medicines are with us, but everybody is doing the mistake is that 7 days of Krimi, 1 per day, and 7th day Krimi is not a good practice. It is what I remember. If you are doing Krimi, do it in the first, because that is apagarshana should be done in the first, not in the last. And the Krimi which is available nowadays in the market, if you look into the 5 brands of Krimi, 5 yogas are mentioned. All those 5 yogas are not there in the respective references which were enlisted in the label, but still majority of the Krimi contains almost similar drugs. So Krimi has to be prescribed 1-3 times a day for consecutively 21 days. Otherwise you won't get good results. Consecutively for 21 days. Then only good results will be available. Okay. And Krimi, Vidangasavam, Chandrasuragadi Kwadam, that is Palasa, Sigru, Vidanga, Drona Pushpi are the different drugs which are mostly inevitable to manage the Prakriti Vighadam. Now, the abdominal colic. Recurrent abdominal colic is so common among the children, especially the neonates and young infants. Faulty feeding habits, frequently feeding without burping, indigestion, chronic appendicitis, giardiasis, cholelithiasis are so common among children. Mesenteric lymphadenitis, as I told you, after MMR vaccination. I will say MMR vaccination is the chief cause of mesenteric lymphadenitis. Not only me, many papers are supporting, including the most infamous Andrew Wakefield, the famous gastroenterologist who connected MMR with autism. His famous paper published in the Lancet later got retrieved by the Lancet by telling apologies in their editorial board. He is also coining MMR with mesenteric lymphadenitis. 5 years back, the British Supreme Court declared a verdict that Andrew Wakefield is right, but nobody knows that. Anyway, Gilbert syndrome, abdominal migraine, abdominal epilepsy, all these are common causes of abdominal colic in children. Regulate the feeding and diet. Indugandham Abhayarishta Gulma Chikitsa is the best area to manage abdominal colic. There are certain lymphadenitis cases in that Antarvidrati Chikitsa has to be given, that is Varanadi. In Gilbert syndrome, in cholecystitis, Kamala Chikitsa by using Drakshadi type of Vadapittahara drug. In UTI, Bruhatyadi, by using Bruhatyadi, the Shobha Chikitsa can be given. Broad spectrum prescription is this from my side, that is Diobayam, Kalachagadi, Kaidardyadi, Abhayarishtam, Kudigasavam, Dhanandra Gulika. There are infantile colic, 3 months of aged children for 3 weeks, 3 hours cry in the evening. 3-month children for 3 weeks, 3 hours cry in the evening. That is called as abdominal colic. In Kerala, not only in Kerala, several states of India, they will do several Lakshakarma. They will do certain puja. They will take some sarshaba and red chilli and 1 pinch of salt, and they will do some mantras over the kid, and they will put all these things in the furnace, so that there will be grand sound of these sarshaba rupture and everything, and there will be fumes all over the house, and the total house will be fumigated by this. By that time is 3 hours are over. By that time, colic is over, patient is happy, mother is happy, grandma is happy, everybody is happy. Take the child with you to a motorcycle, because it is a neurobehavioral disorder. You kickstart the motorcycle, you give the acceleration along with the child's cry acceleration. Gradually, the child will reduce its intensity within 10 minutes, so that you can also reduce the intensity of the accelerator. The expenditure is 200 ml of petrol, even though it is costly nowadays, but within 15 to 20 minutes, the child will stop the cry. So this is a particular neurobehavioral disorder, but still you are supposed to give any of one prasha like Dhanvantari Guliga or Vayu Guliga. Don't give drug over and over within this span of 3 hours, because it will cause gastritis. Because the cry will be shrill cry, the graph will be towards up. So everybody in the family will be panic. So every half an hour, the child mouth will be filled with some sort of home remedies. Finally, at the end of 2.5 hours, child will vomit out, because natural phenomena. Next day, the fever will set in. That is induced by our family members. So don't give medicine over the medicine. Now, genitourinary system, urinary tract infections. These are the 3 common problems that may come across with you in common practice. That is pyelonephritis, cystitis, and asymptomatic bacteriuria. I don't know how many of you experienced pelvic obstruction, hydroureteronephrosis in children. That may be detected even in the antenatal period. If anybody is having such experience, because for me it is a common case, because I am working in a referral center, that is an AIRWAY medical college. That may be the reason. Every month I am getting 2 or 3 cases of chronic hydroureteronephrosis. If anybody of you are facing that, just a text in the inbox. I will deal it later. Pyelonephritis, cystitis, asymptomatic bacteriuria. These are the 3 common conditions, out of which very difficult to diagnose pyelonephritis common practice by the common practitioners. So that think that every UTI is pyelonephritis. That is the best idea. Think that every UTI is pyelonephritis. It has to be considered as antarvidriti. Usual prescription from my side is Brihatyadi Paradavasamam Mulagasamam. If it is pyelonephritis, antarvidriti chilsa by Varanaji, Abragabasmam, Kanmadabasmam, Gugulu Panchabalam Churnam is highly inevitable to stop the gedi of pyelonephritis. Why gedi? If pus is there, there will be gedi. And Gugulu Panchabalam? Kushta Bagandara Gulma Gediknam. Gediknam. It will stop the infiltration of pus into the adjacent areas. And Chirivrcha Kashayam internal use is very powerful in pyelonephritis. Now, ENEURESIS. See, there are 5 things to be kept in mind. Number 1, take the medicine properly. Number 2, don't blame the child or don't tell this fact in front of the others that the child is having ENEURESIS. Third thing, keep a gap between meal and sleep 2 hours. Last meal and sleep 2 hours. Fourth thing, after 2.5 hours of the sleep, awake the child and go for urination. And fifth one, very important one, munch treatment or chocolate treatment. Purchase one chocolate, show the child, this chocolate is for you if you are dry tomorrow morning. And keep this chocolate inside the cabin or inside your wallet, or which is unachievable by the child, just before sleep. Because the child will himself ensure in subconscious mind that I will be dry tomorrow to get the chocolate. Next day, if the child is dry, give the chocolate. If the child is again wet, don't give the chocolate, only show the chocolate. In psychology, this is called as assurance. An ideal prescription of the ENEURESIS should be Krimihara Chikilsa, Medhya Chikilsa, and Vadanulomana. Krimihara, Medhya, and Vadanulomana. I use Vidangarishtam Artachurnam for Krimiharam, Medhyam as Kalyanagiram, Sankushpi, Marasvatram, Abhana Vadanulomana, Sukumaram, Saptasaram, Vastyamayantakam. If you are writing Vastyamayantakam Kridam, don't look back. Majority of the cases will get rid of ENEURESIS. But Vastyamayantakam has a special affinity in its action if it is prescribed in Samudga. What is Samudga? Samudga is the bonsai of Uttama Matra Avapedaka Sneham. It is the bonsai of Avapedakam. Avapedakam is Uttama Matra before and after meals. Samudgam is half teaspoon before meal, after meal. Samudgam. So, Vastyamayantakam Gridam in Avapedaka dose is highly powerful to manage ENEURESIS. In blood vascular system, anemia has to be managed. This is a long subject. I will cut short anemia by your prescription. Usual prescription from Ayurveda practitioners. Anemia. Drakshadi Kashayam. Say another Kashayam by Radhika. One is Drakshadi Kashayam. Second one is whatever you are prescribing.
Mandura Vadagam.
Mandura Vadagam. Okay. See, Mandura Vadagam, Drakshadi Kwadam. Drakshadi Kwadam is Vada Pitta Shamanam. Mandura Vadagam is Kaba Shamanam, little Pitta Shamanam. So how can we manage anemia? Anemia is Kabha in recta. Kabha in recta. Pandu Amayam Shonidage. Mamsa Samsto Arbudavaji. But in Pandu Chigilsa, in Pandu Nidana, Pitta Pradana Kupida Yadokte, he cooperated Chopidam Pittam. That Pandu is the Pandu which will be converted to Kamala after 7 days of intake of Amlaharas. Yaha Pandurogi Seveda Pittalam Tasya Kamala. Have you seen any iron deficiency anemia which are turning to Kamala? No. That is Kabaja Pandu. So Kabaja Pandu, Paitika Pandu. Divide it in 2 terms. Iron deficiency anemia is Kabaja Pandu. Kalyanaga Gridam, which Pandu? Paitika Pandu. Panchagavyam, which Pandu? Kabaja Pandu. Mandura Vadagam, which Pandu? Kabaja Pandu. Drakshadi Kwadam, which Pandu? Paitika Pandu. And Purardavadi Kwadam, which Pandu? Kabaja Pandu. So divide all Pandu into 2. One Pandu which will be turning to Kamala, like multiple myeloma, like bone marrow suppression after chemotherapy of the cancer patients, like whatever may be the problems which is associated with the membrane of RBC, and many other Pandu which are microcytic hypochromic, that is Kabaja Pandu. So Kabaja in nature, Deepanam Pajanam Sneharam Brahmanam, Ashtachornam Chundi, Guluji, Pandurodagam, Dadiwadikradam, Kalyanakradam, and Chanaprasam in Paithika Pand. In nervous system disorder, the child didn't walk, child neck holding not achieved, child have many other developmental disorders. We don't know what is the diagnosis. Leave it. Leave the diagnosis. Mind it only one thing. Whether the problem is increasing as the age advances. As the age advances, whether the problem is increasing. Previously, he used to walk. Nowadays, he is not walking. That is, problem is progressing. If the problem is progressing, mind it, it is fatal. It is not a developmental disorder. If the problem is static or if the problem is improving, that is developmental disorder. You treat it or not treat it, child will improve. If you are treating it, child will improve 4 times. Okay. Child will be improving in 4 domains: in behavior, language, fine motor, gross motor. If you are not treating, child may improve in behavior, not in gross motor or in fine motor, not even behavior. So my point is,